I'm Rena. I'm one of the GPs at the PCC. So we're talking about the vague symptoms pathway today. So vague symptoms can mean a variety of things. It can be losing weight without meaning to, losing your appetite, not feeling like eating, getting new types of pain, so maybe some unexplained tummy pain or joint pains, bone pains, maybe getting some bruising that you can't quite explain, feeling really tired, just not quite feeling yourself. If there's anything that you can't quite explain what's going on and the symptoms are not going away.
I do recall when I was diagnosed, as I said, in 2015, the mental impact and how difficult it was to cope with the not knowing what was wrong. The vague symptoms pathway will shorten the timescale of the tests that will be done to assist GPs to diagnose.
Most people with vague symptoms won't end up with a cancer diagnosis, only a small number will. But what we see in Gibraltar is, unfortunately, quite a few people have a very late stage of diagnosis of cancer. That means you have much worse treatment outcomes and options. If we can diagnose cancer early, we have a much better chance of survival and cure.
I want to talk to you today about some symptoms that you shouldn't really ignore and that you should definitely see your GP about. You normally reach your menopause after the age of 50 or 51, and normally you would miss your periods for about 12 months before we can call it the menopause. However, if you start to bleed after this point, even if it's just a tiny spot, we want to see you about this because it could be a sign of endometrial cancer. If you have a change in your bowel habit, it's so important to get it checked out by a GP. All of us will have off days when our bowels are not the same as usual, but if it's persistent and continuing, you should get it checked out by a GP.
What we've been working on is standardising our approach in how our GPs investigate people with vague symptoms. If you have that, please book an appointment and see the GP. Further information can be found on the Public Health GHA website.